Alrighty, thank you all so much for being here. The title of our presentation is Social Determinants of Physical and Mental Health Among Minoritized Groups. And my advisor is going to be co-presenting with me as well.
Hi, everyone. My name is Dr. Moreno. I'm an assistant professor in the Department of Psychology. Been at VCU for about 6 years now, really looking at culture and contextual factors, social determinants of health, broadly defined, looking at it through interdisciplinary with physical, mental health, and substance use. Prior to being at VCU, I was at the Center for Alcohol and Addiction Studies at Brigham Young University, where I did my postdoc, and now I have the honor and privilege to be able to mentor stellar students like Lisa. And Dr. Johnson could not be here, and so Dr. Johnson and myself do a lot of work, and so this was a perfect opportunity for myself and Lisa to be able to jump in. Lisa being almost having that doctor at her name, so I am here to collaborate and to co-present with Lisa, but the attention being through her. So once again, if you can help me give a round of applause to Lisa for putting this together in 2 days. So here we are. I will also add that this is, of course, a conference on recovery. So a lot of our work is on physical and mental health. So we're going to embed it in terms of how that connects to substance use as well as with recovery. So, we spend a lot of time discussing in regards to using the words marginalized or minoritized. And so we decided last minute as if 2 days ago we started this, right? So last minute to be able to change the title to minoritized for various reasons. So when we think about minority, we're really looking at numbers in regards to a smaller frequency within groups. But when we connect it to minoritized, we're connecting it to a social structure that is essentially oppressing. So if folks are, for example, a minority group, it's more than likely because they're being minoritized by a broader systemic. And so moving forward, when you hear the term minoritized, we're essentially connecting it to a broader system that perhaps is creating these infrastructures, that is creating these outcomes on mental, physical, as well as substance use. I will also note that when we talk about health disparity, we're looking at the numbers in regards to this disparity, but we're going to be using the term inequality because, again, it's connected. These numbers are connected to a broader structure that is continuing to embed on this. So for the purpose of this presentation, we will focus on minoritized as well as health inequalities.
So we have 3 main learning objectives, and the first one is going to be just understanding a little bit more about what social determinants of health are, as well as just seeing how they impact health, how they specifically physical health and mental health, and then what their role is specifically for prevention and then also for recovery. So this is an outline of what we're going to be talking about today. Again, we're going to be getting into the definitions, what constitutes quote unquote healthy people, why it matters, how do we put it into practice, some strategies, and then we're going to leave some time for questions and answers afterwards. So we'll start off with what the definition is, and we're going to start off with recovery.
So when we think of recovery, the SAMHSA defines recovery as a process of change through which individuals improve their health and wellness. So again, it's not just in relation to use, but also thinking about mental and physical health, how they live a self-directed life, and how they strive to reach their full potential. So the goal is really to strive for a full potential on wellness as well as within life satisfaction. So moreover, SAMHSA conceptualizes recovery along the 4 dimensions of health: home, purpose, community, relations, and social networks. So really looking at all these determinants around the individual. There's also other scholars in the field that when they define recovery, they're looking at the experience as a process and a sustained status through which individuals, through which families and communities are impacted by severe substances or just substances that utilize internal and external resources to voluntarily resolve problems, to to heal, to manage, as well as to develop. So again, thinking broadly in regards to recovery as a process of change in which individuals are moving towards a journey of health, wellness, and life satisfaction. It's not just within use, but it also impacts mental health and within physical health. When we look at social determinants of health, social determinants of health refers to the conditions in which people are born, in which they grow, in which they work, in which they live, and in which they age. So this is the social conditions that is encompassing all around. So many times we could easily just look at the individual and their behavior and their use, but when we look at the social determinants of health, we're looking at all these conditions that perhaps may be in relation to everything that's going on. So again, it's the conditions where people are born, where they grow, where they work, where they live, and in which they age. Largely, this shapes individuals' physical and mental health. It impacts their wellness, their life satisfaction, and so social determinants of health is a key proximal predictor in regards to health outcomes broadly defined. And if an individual is dealing with a lot of adverse social determinants of health, it will then impact adverse incomes, whether it's on the physical health, mental health, as well as substance use. So the Healthy People 2030 project is a project that is aimed to assist in properly addressing social determinants of health. The federal government developed this prevention agenda, again, entitling it Healthy People 2030, and it really looks at these 5 factors, these 5 categories of social determinants of health. The first one, for example, looks at the economic stability that could be around food insecurity. Do people have food? Are there food deserts in the area? Or looking at employment, housing instabilities, as well as socioeconomic status and poverty. The other domain is around health and healthcare. For example, thinking about access to healthcare, not just access to healthcare, but culturally responsive healthcare services. Really thinking about access to primary care. How long are the wait lists for the communities that Lisa and myself serve? What are the languages? Do we have Spanish? Are we using translators? Thinking about health insurance within substance use, for example, do these substance use services or prevention efforts, are they even covered through insurance? And if not, then how do we manage the payment and so forth, as well as health literacy? The other domain is around social and community context, such as support, cohesion, as well as community context of discrimination, microaggression, isms. They may be within the context of systemically at the community level. On education, it could be early childhood education, it could be enrollment, it could be aspects of graduation rates or likelihood to persist and graduate. And on the level of neighborhood and built environment, the quality of housing, not just in regards to the quantity, but the quality of housing, the neighborhood decompositions or compositions, the crime, environmental conditions, as well as access to food.
Right. So when we're thinking about these 5 domains, and when we're thinking about how do we get people, the services that they need, we fall into these 2 categories, these 2 terms. One being health equality, right? Everybody receiving the same treatment, everybody receiving the same resources, or health equity, which means not everybody receives the same opportunities, but people with specific needs receive specific resources for those needs. And so the goal isn't equality, but equity. That's what we want to aim for. As we aim for health equity, we're looking at the root of it, which is we're looking at social injustice that occurs that allows for not everybody to receive the services that they need, and that's exactly what we want. So by focusing on health equity, this is a more long-term solution, a long-term strategy to help for policies to create the services that are needed to be able to help marginalized populations and communities, especially with the specific needs that they have.
And so there's a situational problem when we think about health equality as well as health equity. The current situation is that not all social conditions are the same. That the social conditions in which we work, live, walk, thrive, go to school in are not the same. So can we at least meet there and say, yeah, the social determinants are not the same. That is the current situation. However, there's a couple of problems to this in regards to how we conceptualize equality versus equity. The first problem is that the system at play, the systemic structures are very thinking about it as if they were the same. For example, systemic structures, healthcare, literacy is really Western European centric. So that is already, by looking at it through that, then that is making the stance that all social conditions are the same. Why? Well, because the social structures are the same. And then it leads to the second problem, that not all operate through these centricism, not all operate through these frames, which then leads us to the third problem, that those that are not looking at it through Western European centricism, through these systemic structures, are then oppressed. So if we look at it just through health equality, then we encompass all these different problems. But so then this is where, through a health equity frame, we're able to combat all these different problems. So for example, we know that in regards to health inequities and social determinants of health, we know that social determinants of health, whether they're positive or negative, can accumulate over a lifetime. We know the literature shows us that these social determinants of health, whether negative or positive, can alter a person's life course. We know that a person's social determinants of health, whether negative or positive, can also be passed down to future generations. We know that through any discipline, it has an impact. From my lens, as a community clinical multicultural psychologist as well that's embedded within public health, I see this as a public health concern. According to WHO, about 75% of health and inequalities or differences of outcomes could be considered unfair. They could be potentially avoidable, and as a result are labeled out as health inequities. Health inequities are differences in outcomes that are avoidable, unfair, and unjust due to a broader system, a systemic structure. If I can provide more of examples, the Health Equity Report a couple of years ago, and it continues, yes, it's from 2014, almost 10 years ago, but we're still here in 2023, that shows that structural racism is cited as the main source of health inequity. And again, structural racism, thinking about it as a structure that is Eurocentric, neglecting all the other conditions at stake. So that's when we think about structural racism, it's just looking at the first, for example, problem. And so it is when decisions are made on a system-wide level that benefit a certain group and create chronic adverse outcomes for groups that are not within that view. So we're educators by training, and so we're going to give you all 30 seconds for you all just to be able to just pause and be able to reflect. You could do it amongst your neighbor right there in regards to these three reflections. If we can think of a time when, for example, a patient presents with any of these concerns, but how can it be overlooked? And number two, when we think of a time when you have provided a treatment for a patient who presented with concerns within the social determinants of health. If we can think of various ways to alter or strengthen your treatment and practices based on social determinants of health. So 30 seconds, if we can just reflect on one of these. Can we do that? Let's go for it. 30 seconds. Sorry. Yeah, seriously.
So thank you all for taking the time to reflect. Just because of time, we're going to move on. But as Dr. Moreno has been describing, right, experiencing all sorts social determinants of health can impact us in a variety of ways. And so when we experience adverse social determinants of health, it can lead to a lot of physical complications if, again, they're adverse. And so, for example, not having clean water can definitely impact our life expectancy. Not having food or nutritious food, right, can have long-term effects in regards to our physical health as well. And so a specific example of this is, for example, diabetes management within the homeless community, within the homeless population. And so when we think about homeless individuals, they experience many barriers. A lot of them lack safety. A lot of them have safety concerns, don't have food stability, housing stability, lack of employment opportunities, and so on. It's barrier after barrier after barrier. And so when we think of everything that is required for anyone who has diabetes to manage it, it can be a lot, especially when you're homeless and you don't even know if you're going to get a meal. It's a lot of pressure to think about, oh, well, now I have to have a balanced diet and a nutritious meal. When in their forefront, they're just worried about if they're going to have a meal. It doesn't matter what meal it is. And so what we see, what research has shown us is that within this community, for those who have diabetes, the lack of support on different levels, it leads to less effective diabetes management, which therefore increases their chances to develop other medical conditions and then just furthering their physical health as well. And so we see, similarly, we see that adverse social determinants of health, it impacts our mental health as well. And so for those who experience adverse social determinants of health, we see an increase in depression, right? Lack of motivation, feeling sad, gaining weight, losing weight, as well as anxiety, right? That extreme worry, which can lead to all sorts of panic disorders, suicidal ideation, and just overall psychological distress. And so again, a really a good example of this is food insecurity, which reminds me of a patient that I work with. During our first session, she was referred to me and she mentioned, I really want to talk to you, but I can't focus on what my emotional needs are because I'm too hungry and I don't know if I'm going to have anything to eat for me or for my family tonight. And so again, that food insecurity, especially when you have a family, can lead to all sorts of psychological distress, ranging from, again, depression, anxiety, and even suicidal ideation. And so for those in the healthcare positions, it's really going to be important for us not only to acknowledge, but then also create a standard practice where we're screening for social determinants of health. That way we can see what patients, what individuals, what clients need, and then be able to address those needs.
Yeah, when we think about social determinants of health connected to substance use as well, we know that all these structures have been linked to increased risk of substance use, overdose, and at times even risk for recovery. We know that some of these structures as well have prevented communities, particularly Black, Indigenous, Spanish-speaking, from having equal access to the resources needed to be healthy. We know that poverty poverty, adverse childhood experiences, intergenerational traumas, and intergenerational use are all social determinants of health influenced by these structural systems. The health inequalities also experiences by these communities as a result of social determinants of health result in increased use of substance use risk as well as these disparities for these marginalized, minoritized groups. So we know that when we think about these social determinants of health, we would want to, at minimum, in regards to assessment, really be thinking of when I'm serving or when I'm providing client care is what are the social determinants of health that are potentially impacting, right? Even just thinking about food, we not just because we got up, drank our Starbucks, had our meal, doesn't mean that everyone is going through that. So what are the social determinants of health that are impacting the use? Another social determinant of health that closely linked to increased risk of mental health and substance use is adverse childhood events, ACEs, as well as negative life events at adults, NLEs. So ACEs, potentially traumatic events or NLEs that occur during childhood, for ACEs and NLEs for adulthood. ACEs include experiences of witnessing violence, abuse, neglect, having a family member attempt, or there's death, homicides, and so forth. So ACEs do not impact all equally. I'll say that again, ACEs do not impact all equally. And so persons from marginalized or minoritized groups are more likely to have multiple ACEs than the dominant group, which in theory and empirically may be more susceptible for use. So if we can give you all 30 seconds, after discussing the physical and mental health and substance use challenges that can be created or worsened by social determinants of health, if we can reflect on one of these 3 points. One, if we can think of a time when a patient presented with any of these concerns, however, you were unsure of how to properly treat them, what did you do? Or how do you manage it? And the second one, if we can think of these various physical and mental health conditions and link them to certain populations or groups that you're seeing in terms of communities, who are they and what are these social determinants? And the third one, if we can think of a time when you can have provided perhaps more adequate treatment or more useful resources for a patient who presented with these social determinants of health. So can we do 30 seconds? Let's do it.
Thanks to everyone for pausing and reflecting and speaking to the person that's next to you. But again, just for time, we're going to move on. And so how can we promote health? By promoting health, we're also talking about a little bit in regards to prevention and reducing psychological distress, as well as any complications in regards to physical health. So there's a variety of ways that we can promote health. And one being collaborating. Are we collaborating with other professionals who may have more expertise in a certain domain than we do? Is there opportunity to work in an integrative behavioral health care where, again, we're able to work with a variety of professionals and providers, and we're able to get like a bigger scope of the health of the patient that we're treating? I really, really like the resources and distribution. How familiar are we with our communities? And how familiar are we with what our communities have to offer to our community members? Are we familiar with those? If we're not, why not? because by being familiar with these resources, we can definitely benefit people, patients that we see, clients that we see, by distributing and having these things ready. And again, it allows for community engagement. It allows to develop strong partnerships. And it allows us to advocate for our clients, because if we're getting to know what their needs are, then it allows for these conversations to flow in regards to, okay, well, this is what the needs are. This is what our institution offers. If we don't offer this, or if something isn't in place, what can we do to get something into place? Who can we partner with if we don't offer said resource that's needed?
Lisa, if I can just jump in really quick as well, it's one of the things that to be able to, if we're able to see it through an interdisciplinary frame, it takes a village for client care. And not just in regard to the treatment, but also in regard to the conceptualization, thinking clearly of all these social determinants, not just looking at it through like a biological frame, or not just even looking at it at the individual lens. When we look at these health inequities, we realize that it's the systemic structure that perhaps is impacting all these different outcomes. So yes, we may be here for substance use and recovery, but at the same time, the same community may be impacted by mental health, emotional health, and so really thinking about who do we have on our team that is really helping us within this client care, because at the end of the day, we all work holistically. So thinking about who is either on our agency or who we can refer out in regard to thinking about all these different disciplines: psychology, psychiatry, nurses, social workers, case managers, and so forth, because the days of just thinking about one domain and one provider doing it all, the literature has shown that although it was effective at a time, it's more effective when we're really doing this as a village within our communities, for our communities, by our communities, to our communities.
Here are just some resources. And then we're going to pause for another reflection.
So this one will be a little bit quick, but really thinking about, how do you engage in health promotion? How does your agency or your team engage in health promotion? Whether it's just on the treatment side, but what about in regards to client care, in regards to conceptualization, prevention, recovery? Do you have a list of resources for those experiences, adverse social determinants of health? How do you manage social determinants of health in all these different areas of the treatment modality? And how can we always, because there's always areas of growth, how can we grow and improve our list of resources as well as just distribution of care in our community? So if we can do 30 seconds with your neighbor, go for it.
The next slide has a little.
Thank you for letting me know. Yeah. So in regards to what role do we all play, all of us that are here, how can we assist? What role do we all play when we're talking about client care as well as within the social determinants of health? One of the implications that the literature talks about, as well as my research team, is we can always engage in more education. We can always, yes, we may have our degrees, yes, we may have our professions, yes, we may have our experience, but communities change, policies change, infrastructures change, time changes, even with technology, and even, so really thinking about education as a process of a spectrum. So we can always continue to engage in education related to the social determinants of health in the communities that we live in, work with, and serve. We can always ask questions based on prevalent needs in the surrounding community. This is where the needs assessments always come at play. You can collaborate with others to provide, and we can provide resources for patients based on their symptoms and circumstances, as well as use universal assessment of social determinants of health.
So then we get to the question, since we've reviewed a lot of information, how can we put this into practice, right? And specifically, there are a variety of theories that do a beautiful job of highlighting just how different systems and different layers impact us on an individual basis and how it impacts our mental health and our physical health. And also, when we think in regards to the world of psychology and the world of counseling, we also have what we call the duty of beneficence and then also the duty of justice. So when we think of beneficence, right, we're thinking about the welfare of our patients, the welfare of our clients. And when we're thinking about justice, we're thinking about not only treating our patients equally, but then also making sure that they have equal resources as well. And so not only is incorporating social determinants of health, not only does it fall perfectly into place with our theories, but then also when we think of ethics, it is our duty to go above and beyond, and not even above and beyond, but just to get to know what our patients' needs are beyond what they're presenting. And that way we can see what their needs are and be more specific about treatment.
And if I can just add really quick, all these models allow for an opportunity to assess social determinants of health at all these different lenses. So whether the Bronfenbrenner social ecological framework or the eco-social theory, all these different levels at the individual, interpersonal, organizational, community, public policy, have an opportunity for us to be able to reflect on the social determinants of health within our clients. If we tie more home, the social ecological model of substance use and overdose prevention, but as well as within recovery of intervention, is one that also within is a frame that allows us to be able to look at all these different needs and all these different layers that perhaps are impacting these social determinants of health within substance use and use outcomes. It could be at the individual level factors, physical, mental health, perhaps there's trauma, perhaps there is social, emotional learning and skills. This is what a lot of us in this space engaged in, harm reduction, withdrawal symptoms. But we know that it's not just at the individual level. We have to also be able to assess and intervene at all these other levels, interpersonal, whether it's family, friends, networks, could be access at the peer level. It could be even attitudes. It could be perceptions of substances. It could be either positive within the friend network, or it could even be the stigma behind, even stigma around seeking care. So that at the interpersonal level, at the community level, really thinking about the access to culturally specific providers, agencies, thinking about behavioral health services, drug disposal facilities, access to all the different substance use services at the societal level. It could be even just the stigma towards people who use drugs within the society. It could be really thinking about the perceptions and attitudes and even policies that are there, that legislation is passing through at the societal level. So again, you and I, a lot of the times, engage in client care at the individual level, really thinking about myself as a psychologist, being trained as through the psychology discipline, thinking about it at the individual level, but knowing that this is contextual and this is the individual in relation to the interpersonal, to the community, and to the societal. So just looking at it at the individual level is a good start, but we also have to start looking at it at these other levels. Substance use, prevention, overdose, as well as relapse prevention can focus on a single level of this model, but interventions that work across all these multiple levels are more likely to be more successful. So a good place for us to start would be, how am I, my plan, the services that we have, my conceptualization, how is it also playing a role on the interpersonal, community, and societal level, not just at the individual level. When we discuss the social determinants of health, a lot within the literature use terms of upstream and downstream. So upstream being towards more on the bigger circle, where the downstream is more on the smaller circle, and it refers to the levels of this model. So upstream refers to policy changes, really refers to the larger scale of prevention efforts, hospital systems, agencies, legislation, where at the individual downstream level will refer to the treatment and programs that are focused at the individual level. Again, more than likely, many of us in this space are engaging in the downstream of treatment, but really thinking critically in regards to how can we also engage in more upstream, where it's really making policy shifts, where it's really making a shift, a change within the system. So again, at one level, literature shows, yeah, it works. But there's also an opportunity to engage on all these multiple levels for it to be more effective across all these different levels. So using this ecological model of SCM and substance use on overdose and relapse prevention, we can trace how societal change can influence individuals' health. At societal level, for example, legislation passed at a state level that would be more upstream, that supports expanding, for example, medication-assisted treatments can have a positive impact at the community level, which can have a positive impact at the individual level. So a lot of the times we focus on the individual level. However, the literature shows that when we focus a lot of our energy on more upstream, it may assist as well.
So when we're talking about assessments are used to gather a lot of information about the patients that we're seeing. And so not only are they a useful tool for us, but it is also considered a primary intervention for social determinants of health. And so this is something that can be really, really useful when we're thinking about gathering information beyond just mental health distress. And so the big questions are, well, if we're going to be engaging in assessment and asking questions about social determinants of health, who do we know who to ask, right? What patients do we ask? And the answer is everyone. Screen everyone. Make it a standard practice in whatever institution, organization, hospital setting that you're at, because you never know what information you'll find. And so it's a good practice to just have something ready. And in regards to when to screen individuals, that's up to you. It really is feeling out what feels best for you, what's done in this specific institution that you're at. Where I'm at, it's just something that we do at intake. There's just like a lot of paperwork that you have to do, a few assessments, and one about social determinants of health is just one of them. Others do it after a few sessions. Others do it intermediately, like check-ins during sessions. And so it really is just finding what is a good practice where you're at and what feels good for you. And so there's a variety of screening tools that can be used for social determinants of health, and these are just two of them. So the good thing about these two, the WellRx and then also the AHC, is that they're free and you can look them up online. So it's very easy access to them. And so a strategy that is really good when we're thinking about social determinants of health is really learning about your community. So for example, specifically where I work in Children's Hospital, like the surrounding area has a lot of Latina immigrants. And so what are the needs of Latina health immigrants, right? And so then it's my job to see what the community needs are and then finding resources to help connect and bridge those, the needs for the community members. And so here's just the WellRx questionnaire, and it's just 11 questions, but again, very simple, yes or no, very short, doesn't take more than 5 minutes, but it gets at a variety of things that fall within the 5 social determinants of health. Are you employed? Do you need help finding a better job? Do you need more education, et cetera, et cetera? So again, very useful tools that we can incorporate into our practice and really don't take too much time.
Yeah, and the take-home message is really thinking about, when we think about the individual within substance use and even recovery, right? Is it just at the individual level, or is it because it's also connected to a broader relationship of systems? And really thinking critically about these social determinants that perhaps are engaging within risk, that are engaging use, that are also impacting other aspects of health and wellness, mental health, physical health, and perhaps may be impacting recovery. And so not just thinking about or even pathologizing or labeling at the individual level, but really thinking these systems at play that are making it more difficult for certain groups, specifically marginalized and minoritized groups. And with that, we want to thank you, and we open it up for questions.
Thank y'all so much.